Arizona's children have been getting COVID-19 at a higher rate than most of the rest of the country.
And according to the most recent data put out by the American Academy of Pediatrics, we are third in the nation for child deaths. News 4 Tucson's Chorus Nylander investigates what may be driving the numbers and what medical experts expect moving forward.
The American Academy of Pediatrics and Children's Hospital Association have been collaborating on compiling data from across the country for months now, specifically on COVID-19's impact on children. In Arizona, the numbers have been consistently high. Something as simple as the morning breeze or nature's beauty has Juan Antonio Lizarraga feeling thankful to see another day with all of his loved ones still by his side.
It took a big toll out of me.
Juan and his entire family, his mother, grandmother, and 8-year-old sister, all caught COVID-19 and got very sick at the end of May.
It was like a very bad flu. We couldn't taste anything, we couldn't smell anything.
Juan says his greatest worry was for his grandmother and little sister.
It was very scary.
Being just 19, Juan and his little sister are among the growing list of more than 47,000 children who have caught the virus in Arizona, which categorizes child cases ages 19 and younger.
It definitely did a lot of damage, even to someone as young as me.
The American Academy of Pediatrics and Children's Hospital Association have been compiling weekly data reports tracking cases of COVID-19 among children across the country. According to its latest report, Arizona has the 6th highest number of cumulative child cases in the country, but the 3rd when it comes to deaths. 11 children have died in Arizona since the beginning of the pandemic.
We've been at the top of the charts now for about six weeks, 2 months or so.
Dr. Sean Elliott, a pediatric infectious disease expert with TMC-1 and TMC hospitals, believes the lingering high number of cases can be blamed on our climate.
Arizona, where we take refuge when it's 112, 115 degrees out, we were inside being exposed to others via air conditioning and infecting each other.
But the summer is behind us now. Temperatures have been mild. Why are our cases still surging?
That's all based on our social patterns and our inability to wear masks where we need to.
Dr. Natasha Bouillon, an assistant professor at the U-Arizona College of Medicine in Phoenix, agrees with Dr. Elliott, but also believes demographics may be playing a tragic role.
When we look at pediatric deaths from COVID-19, 78% of those have happened in children of color, so children who are Hispanic, Black, Native American.
Dr. Bouillon says information is crucial to addressing the situation, but so far in Arizona, she says some important details simply aren't available.
Where is the contact tracing data? Where are those children getting sick? What are the characteristics of those children? And so ultimately, I wish I had an answer for you. We have theories. We don't know for sure.
Currently, the best way to gather information, she says, is through local health departments. News 4 Tucson went county by county across Arizona, looking over health department COVID dashboards, a time-consuming task, and when it comes to child cases and deaths, not all information is equally accessible. We could easily find, say, Maricopa County, that 3 children have died. In Pima County, the number is 0. But in more rural areas like Cochise County or Yuma County, there was no data displayed for child deaths. In Mojave County, they threw all deaths together for people 50 and younger.
What we're really lacking is that transparency into the pediatric data. You know, on a national level, we have data about things like obesity and asthma. But when you drill down to Arizona, when we look at the children who've gotten COVID, the children who've gotten severely sick from COVID, and the children who've died from COVID, we don't know much about them.
A potentially fatal flaw.
Having that information, it can help us prevent future cases.
For Juan, he says he just hopes more people will listen to the advice of medical professionals.
At the end of the day, like, masks do suck. Having things closed early does suck. But at the end of the day, I just want my own family to be safe.
And Dr. Bouillon says take no comfort in the speculation at the beginning of this pandemic that children essentially don't get the virus. They may not get as sick as the elderly, but she says the evidence is clear at this point they can spread it. And as children do, follow by example. So if you're not following the recommended precautions from medical experts, likely they won't either. Investigating for you, Chorus Nylander, News 4 Tucson.